Now! Stop the bullying 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 now!
Point to the case of a hospital interpreter, Lan Ung. They say she left work on family leave to take care of her ailing mother, and that when she returned, her managers harassed her.
It's not just her situation. There are many other workers who are being bullied on the job, harassed on the job, and many of them go out on stress, and it's wrong.
The activists say not only is the harassment illegal, there are specific bullying protections in the union contract. We called SF General for comment today about the allegations, but have not heard back.
Speakers talk about the issue and why it's important that all working people stand together, and the consumers, the people who use these services, need to understand the workers want to provide a good service, but they can't provide a good service if they're being bullied. That's what happens. You're stressed out and you can't provide the service that is necessary. So this is not just an issue for the worker themselves, it's also an issue for the public and the people who use the services here at San Francisco General Strike, or General Hospital. So our first speaker is Brenda Barros. Brenda is a union leader here, an activist, and has been organizing to oppose bullying in San Francisco against city employees.
We need everybody to start thinking about this issue. At San Francisco General right now, they have a program what's called Service Excellence. And so something successful that happened today was when we had that meeting, they talked about a 360 evaluation. That's where employees are evaluated with each other. So I was able to make a clear, concise argument why this is not the time for something like that, because there's a lack of trust among the employees. Many employees feel harassed and bullied, and it happens on a daily basis, and it's affecting people's health. It's affecting how they do their job, and it's affecting the care that they give to the patients. So we need to stop this. We got bullying language in our contract, so now it's up to us to implement it.
A senior Asian language interpreter in San Francisco General Hospital is waiting to find a hostile working environment and ask for resolution for my peer and my supervisor to treat me fairly. I have been mistreated since David Dow became supervisor and continued bullying me on many occasions. Since my mother's death, this had been going on issue, which affected my daily, which not have been resolved. My day begins 8 a.m. and at 4:30 p.m. Our department is constantly busy with call, face-to-face, phone, video, monitor, interpretation for various patients, doctor, nurses, and activity. And duty have been affected. My fear who refuse to do their job duty is always having conversation with her friends, which she refused to take more than 10 calls a day, which is hiding in the bathroom. She is hiding from her work. Moreover, David conversation, meeting with my peer, leaving me with 20 to 25 calls a day. I feel work is not being separated fairly. And I am giving their workloads on top of mine, which is overwhelming. In reference to my palliative care human resources, Associated did approve my accommodation by not exposing me to palliative care. David and one of my co-workers had not accommodated XR requests nor care on my behalf. Until recently, they are sending more calls to my attention. This go again.
Okay, take care. Okay, you're okay. Take your time.
It's pain and suffering.
You can continue to read it.
In references to the palliative care, Human Resources Associates did approve my accommodation by not exposing me to palliative care cases. David and Julie have not accommodated HR's request nor care on my behalf. Until recently, they are sending more calls to my attention. This goes against the First, Fourth, and Ninth Amendments of the Constitution. Free to establish my religion, prohibiting my rights to grieve by peaceably to assemble my pain and suffering, They also refuse to secure any affirmation by HR, doctors, and for standing my liberal rights. Yet they also refuse my own individual rights for my own well-being. Especially, they do not care for my safety, which I feel threatened and overpowered by them. They do not care for my best interest, nor have the rights of others. I feel threatened by Julie and David's slander, which cause harm to my reputation based on their personal hate against me, proven in plain view. Again, I am asking my management team for help so I can be treated equally. David and Julie continue to harass me. I would help from my management to discontinue their hatred against me. Sincerely, Lan Ung, March 12, 2013.
So we're here today at General Hospital to defend Lan Ung, because it's not just about Lan Ung and the harassment, the terrorism she's going on in the job. Many public workers, many workers at this hospital are being intimidated and terrorized by their bosses. Now the city has a program, they want to have the wellness program. They're saying they want to save money for the city of San Francisco by having a wellness program. And Mayor Ed Lee and the Human Resources Director are negotiating right now with the unions about a wellness program. Well, what we have to say is, how can city workers be well when they're being harassed on the job? How can they be well when they're being bullied? And many of them have to go off on disability, on workers' comp, because of the bullying on the job. This is wrong. This is costing the public money, and this is terrorism against public workers, because they're bullying public workers, illegally bullying them, and then they're going off sick, they're having health problems, they can't help themselves, and they can't help the public if they're being bullied on the job. And we have to stop it, we have to educate people about it, and it's not just a problem here in San Francisco at the General Hospital, it's a problem in Richmond, it's a problem in the schools in San Francisco, at the Martin Luther King School, where the kids and the teachers were being bullied by the principal. In fact, a principal sat on a student, 300-pound principal sat on a student, and they covered this up. There's an investigation now at the district attorney's office. It is illegal to bully people. It's illegal to terrorize people. We want it to stop, and we want to let the public know that this is an issue of public health and safety for the worker and health and safety for the public, because the public is not served when workers are stressed out and bullied on the job.
My name is James Kenneth Terry. I work at the Behavioral Health Center. A year ago, I was terminated for 15 months because I referred to told one of my clients that she'd become a little butterball, and the clothes I had bought her wouldn't fit anymore. I was terminated for 15 months. I went through arbitration, and the arbitrator decided that he did not believe anything that was said against me, and I was brought back to work with my full back pay, which was over $105,000, and I was out. They denied me unemployment during the time I was out, so for 15 months I had no income. Just Monday, over the weekend, a client put his hands on another client. This is staff, and forced him in the room and locked him in, which is you cannot do. They got together on Monday morning and decided this does not happen. Before they did an even investigation, they got together and said it didn't happen. They got witnesses and everything to say it didn't happen. But the resident said it did, and another resident witnessed it. But they said, oh, it didn't happen. Okay? So they run to cover up. Just on my way down, a client got hit by another client. Between two staff members. They didn't know. No one saw it. They want to cover up everything. They're afraid for the state to come in and see what they're not doing, so they covered things up. And they abused me. I had to report a doctor on Monday to his supervisor for his verbal abuse of me, talking to me like I'm his child. If I use the word ridiculous referring to a behavior, and he reprimanded me like I was some little elementary kid. No, you don't talk to me that way. I'm 62 years old. You don't talk to me like I'm some young kid. If I said something wrong, then you talk to me like a man. But they want to talk down to you, belittle you, and then they isolate you. They have everybody else turned against me. So now I walk around the unit and no one speaks to me or addresses me. because they're all on the same team. It's open field on Terry. You can attack me, do whatever you want to do, and nobody's going to say or do anything about it. So this needs to stop. I had to put in for FLMA because of the stress that I'm going through. I am a disabled vet, and the VA has now prescribed medications and have authorized me to take FLMA because of the stress that I'm under, having panic attacks. Never happened before, but I'm presently having panic attacks due to this job. That's not the way it should be doing. I work with the mentally ill. I shouldn't be having to have coworkers that are mentally ill and affect my mental health. Okay, this is not okay. Okay, thank you very much for allowing me to speak and share my case with you.
Hey, my name is Terry Lukowitz, and I used to work at HSA. I have been bumped out of my position 5 years ago, but prior to that I was bullied, belittled, and treated, as he says, as a child from a young girl that was way younger than I was. I was 55 years old when this all started, and she made me feel like I was stupid, dumb, and she even recommended that I take a disability because they wanted me out of my position. But she was also sneaking around polls, checking on me, going whatever she can do to find out something on me to fire me. But it didn't happen until the bump came, and then I've lost my job. They were supposed to, the classification I had at the time was the Rec and Park. They were supposed to change our classification so we would be able to have our own classification. They said it'd take a while. Well, it didn't take. It's supposed to have been done before the bump, which they didn't do. And 2 months after we were let go from our jobs, they came up with a new classification. I was called in for an interview to go back into the job on that position in that new classification, and I was denied because I didn't have the qualifications after 11 years. So I've been out of work for 5 years. I've reported it to HR prior. They didn't do nothing. Just as he said, it was, they covered up. They didn't do nothing. I put a grievance in. They didn't do nothing. So I've been out of work, and I've just been volunteering, helping these people everywhere. Don't want them to go through what I've been going through.
I'm the chapter vice president here at San Francisco General. A lot of people see me as like this strong person who, how could somebody do something to me, right? So I went through it myself. And it started, I was here over 30 years at the time. We got a new medical director, and this woman came in the door and did things like pulling people into side rooms, pressuring people to say negative things about me. And it just so happened that the upper administration at San Francisco General, who had worked with me for those 30 years, they saw through all that. But if they didn't see through all that, my life would have been hell. And I know that. And I'm appreciative that the upper administration in this hospital does value what I do and knows that I care about this hospital and knows that I care about the people that work here and knows that I would never do anything to harm a patient. But there are other things, and it happens to people sometimes all the time, sometimes every now and then. But the issue is that it's wrong whenever it happens, or how often it happens. And we need to create an environment at San Francisco General, and I think administration is attempting to do that, to change the environment so that that is not acceptable behavior, no matter what level of employee you are, or how high you are. It shouldn't be acceptable from anyone.
I remember reporting one of our employees that worked with us, and they had to let this person go. And my supervisor came in because I think he was related to that person. And she said to me, you know, Terry, you reported him, he's moved on, but I want to let you know one thing. It's not what you know, it's who you know. And I wanted to let you know that.
And the double standard is that when workers violate the rules, they're retaliated against. They're disciplined. When managers and supervisors violate the rules, it's okay. And what we're saying is there has to be transparency and there has to be equality of treatment. that it's unfair to treat the employees, the rank and file workers, different than the managers. And especially the health and safety aspects of this. Why is it in General Hospital, where people are supposed to be taken care of to get better, they're being mistreated? The workers who are serving these workers, the patients here, are mistreated. How can they take care of the people who come to General Hospital to get well when the workers themselves are mistreated? True. This is a tragedy. It's something that has to stop. It's been ongoing, and it's not an isolated incident. This is what we're saying. There are incidents all over the city. There are incidents at Martin Luther King General. The attack on workers, on public workers, the harassment, the bullying on the job is systemic. It's endemic. And it's only going to stop when the people who are injured, the people who are being injured, and workers who understand that, and the public understand that, stands together and say enough is enough. We've got to stop the bullying of workers on the job. We've got to stop the harassment. People have a right to a humane working condition. There are many workers in the city and county of San Francisco who are off on disability. And the reason they're off on disability is because they've been bullied on the job. They've been harassed on the job. They don't want to be on disability. They want to do their work. They want to take care of the patients and do their job. They're being prevented from doing that by a management who's bullying people and harassing people. And this is unacceptable. And what we're saying, United Public Workers for Action, union members and others, is that we are not going to tolerate it. We're going to go public about it. We're going to let people know what's going on, and we're going to stop it. Because it's an endemic thing. It's unhealthy for our society to have this going on. It's unhealthy, and people have a right to live decently. Since when should we have bullying to be a regular thing? Yeah. It's acceptable. People in management seem to think it's acceptable to bully workers. It's acceptable to harass and bully workers, and they get a kick out of it. It's a sick culture. If people have seen the movie The Corporation, I don't know if people have seen that movie The Corporation, but it's psychotic. Yeah. It's a psychosis that people think it's good to bully, and this is you get a reward, and you get a promotion if you bully people successfully. Yes. That's what's going on. People are getting promotions for bullying workers out of their job. Now, you should get promotion for helping workers and for taking care of the patients, not for bullying people out of their job. But it's twisted, and it's really the wrong dichotomy that we want to have, particularly at a public hospital in San Francisco. And we're saying the management, Mayor Ed Lee, they're talking about wellness. They're talking about taking care of the health care of the employees. Start with stopping the bullying. Thank you. Start with stopping the bullying. When you stop the bullying in San Francisco public employees, you'll have a healthier environment, you'll have less people on disability, and they will be able to provide better services because they're not stressed out. And that's what we're really talking about. Providing the health care, providing health for the people of San Francisco, providing a healthy environment. It's a right, a basic human right that everyone wants to have.
These dangerous working conditions in the Behavioral Health Center and also at Laguna Honda Hospital have to do with patients with mental problems being released from the psych wards on San Francisco General earlier than they should be. Medi-Cal provides for a certain number of days for people to be held in the locked wards of San Francisco General, and when that money runs out, they're sent to behavioral health whether they're ready for it or not. And this is what's largely responsible for these dangerous conditions in the Behavioral Health Center. This is a problem which has gone on for decades. Thank you.
And I went to doctor because work here I have to take a call like palliative care. This is what they went to, what I went to. And I cannot control my emotion. I tear. And then I went to the doctor, and the doctor gave me a waiver for that call. I went to what is that called? ADA? American Disabled American, which is they accommodate for my time off. No, not to go for that call. Somehow one of my co-workers were bullied, which is one morning and also my supervisor already emailed that not to send me for that call. One morning she come in, she sent me for that call anyway. And when I go into that call, I find out that this is, I have to avoid because could be get more stressed and sad. And then I call her, I need for help. And then when I call her, what she said, I don't know, but who else I can say but you? But when
let me see if I can help you out.
Yes.
Here, just a little bit in there.
Yes.
So you've had problems with vacation, and you. They're not. What you're saying is they're not responsive to your complaints, your concerns.
No, they're not. They're not. They're not. I wrote so many letters to him and to Human Resources. Nothing happened. Nothing happened. And I have been like picking on the same post worker, at least one, 2 or 3 people in that department.
You feel like you've been harassed and treated?
Yes. Harassment, untreated, not respect.
In her office, notified my supervisor.
You're still working though?
Yeah, I'm still working.
What did you call her
And it sounds like you just, obviously emotional. You're emotional when you talk about this. Obviously, it's impacting you.
Yes, it is.
How much is it impacting?
And they told her
it's impact my health.
Oh, we're going to get on
and
that.
Also,
we're going to get on that.
Which is
no,
I cannot sleep.
I think she would have done something.
I'm not eating well. And I get scared when I come to work. And other issue, and it's a long story. I got, he wanted to try to put on disciplinary several times, and this is Brenda over there trying to help me out.
Stop the bullying now! Stop the bullying now! Stop the bullying now! Stop the bullying now!